This is Amanda Horowitz, Joseph Norton, and Courtney Ang, and our Bridging the Gap summer project we called Forming Connections in the Time of COVID-19, Depaul, USA, summer 2020. And we were all three of us at each three different organizations under Depaul, USA, and we had three different preceptors that we met with regularly and our academic preceptor, Dr. Cruz.
This is Joseph. My community partner was at Depaul House, which is a 27-room transitional housing facility in the Germantown neighborhood of Philadelphia. Depaul House works to help adult men who have previously experienced homelessness break the cycle of poverty, primarily through gaining employment and securing their own housing. Depaul House works under the harm reduction model and seeks to meet residents where they're at.
This is Amanda. My project was with the St. Joseph's House, which provides stable and safe housing and services for college students experiencing the immediate crisis of homelessness. The program aims to support students as they continue and complete their studies. This is achieved through various services that include basic housing, case management, counseling referrals, transportation, food stipends, textbook assistance, and educational reimbursements.
This is Courtney. I worked with St. Raymond's House, which is located in the East Mount Airy neighborhood of Philadelphia, and they provide permanent supportive housing for adult men and women experiencing homelessness and chronic health conditions. St. Raymond's works with its residents to bridge the gap in access to services by providing case management and connecting the residents to healthcare, and providing nutrition and counseling, therapeutic groups and activities, computer literacy tutoring, and harm reduction focused recovery counseling. St. Raymond's also uses a strengths-based approach to care, promoting self-determination and autonomy of each resident. So as a group of interns under the Depaul USA organization, we work together to support our community preceptors and the residents at each of our respective community sites by making advocacy materials that included flyers, brochures, and keychain cards. Some of the materials that we made included information regarding harm reduction, opioid overdose response practices, and anti-bullying resources. And these were some issues that have arisen this summer as a result of the COVID-19 pandemic. We also gathered information regarding activities promoting cardiovascular health, such as access to outdoor spaces in Philadelphia, farmers markets in Philadelphia, where residents could access fresh and affordable produce and easy recipes that could be made using minimal ingredients and minimal cooking utensils and cooked on a hot plate. We also conducted interviews with residents at each of our respective sites to become more acquainted with them and the population that we've been working to serve. And we also held mindfulness meditation sessions with residents to discuss stress reduction techniques during the COVID-19 pandemic.
On this slide, we have a compilation of some of the projects we worked on over the summer. On the left, we have our harm reduction brochures and flyers, which include some safe practices for IV drug use, marijuana use, alcohol use, and medication use, and signs of an opioid overdose. In the center, we have an anti-bullying campaign that we created, along with tips for dealing with quarantine conflicts. And then on the right, we have our cardiovascular health and smoking cessation flyers, which includes how to access healthy and fresh foods via the Philly farmers markets to promote a healthy diet, and some benefits to quitting smoking and what to do if you're thinking about quitting smoking.
Reflecting on our summer experiences, a few themes stood out to us. The first being how socioeconomic differences influence health, both at a population level and an individual level. This is definitely something that was emphasized in our first year medical school curriculum. However, assisting organizations that are really serving these populations directly day to day gave us a much deeper appreciation for how socioeconomic differences influence health. Additionally, working as a team of three, we gained a lot of experience working collaboratively with one another and how to serve three separate facilities that had often similar but still distinct needs. So that also gave us experience in receiving feedback from both supervisors and from our peers and when to suggest our own ideas. And this combined with our experiences with our various populations will definitely be incorporated into our future practice as physicians.